chest thin. I haven't done a chest surgery catch-up for a while, so I thought I'd better do that. I'm now 5 months, 2 weeks and a couple of days post-op. It's gone so quick, and I'm really pleased with how things are healing, so I'm just going to show you that first, and then I'll talk about some stuff. Okay, so this is my chest at 5 months, 2 weeks and a couple of days. Everything is healing really well. In terms of how the scars look, I've been really careful, and so they've stayed nice and thin. They're also very nice and flat. I mean, even if I put my arms up, you can see that there's really not much stretching at all. Still using the scar massage and kelo-cote twice a day, sometimes 3. Scars are really lovely and flat. I'm just really pleased about the healing. You know, if I'm going to be picky, there's that little tiny strange thing there. It doesn't really bother me. And there's a couple of here as well where it's still healing. There's like a little tiny bump. Excuse my spotty chest at the moment. My hairy chest is coming through. Yeah, so I'm really pleased, and I can't fault that. I just think that looks absolutely fantastic. I love where the scars are in line, and as I start to do some weights, hopefully that will kind of blend in, and hopefully the hair will come and blend in as well. So yes, close up. And to talk about the nipples, let's come up a bit closer. I'm really happy with what's happening there. They are starting to kind of shrink down a bit, because I did feel in the beginning they were a little bit on the large side, especially kind of not so much the areola but the actual nipple in the middle, but I'm actually quite happy with that. And this one's actually coming out more, was that one doesn't seem so defined in the beginning, but it does seem more defined like this one now, and the edges of them are starting to flatten as well. The only thing is, I am getting a little tiny bit of discomfort in them. It's not pain, but it's just discomfort. When they're like this, it's fine, but as soon as they kind of react to the cold or to touch, and they tighten up, they can get a little bit painful. So I have messaged Ginny to just ask about that. I'm sure that it's just a case of them healing, but I just want to be sure. Okay, so I'm going to stop flashing my chest at you now, and give you my face. Okay, so that's better. As much as I like to flash my pecs whenever I can, sometimes you just want to look at my face. Right, so yes, really pleased with this wonderful result. I couldn't be happier. And it's coming up to summer now, so I can get my chest out. What I've just started doing is I've just started weights again. I've started, as I say, I'm 5 months, and I wanted to wait a good 5 or 6 months before I even attempted it. Some people might think that's a little bit excessive to wait, but this takes a lot of time to heal. Scars take a year, 18 months to properly settle. So I didn't want to do anything that was going to risk stretching them, whether it's kind of doing the weights or whether it's the actual muscle increasing in the chest. I didn't want to put them under duress until they're properly, nicely settled. It's frustrating, but I figured waiting a few months to preserve scars would be better than just rushing ahead. So I'm now got a little bit of time before summer hits to get buff. So I started weights last week. It's all gone really well. Not had a problem whatsoever. I'm not doing the huge progressive overload and failure training like I was before. Failure training, not failure training. I'm really increasing quite gradually. I don't want a sudden increase in chest muscle, basically. I don't want anything. You know, when you lose or gain weight, you can get stretch marks. It's the same exact concept. If I get too big, I could stretch these too quickly. So there's nothing been really overly... No, it's nothing, but nothing has been uncomfortable at all, except when I do weights above my head. When I do this, there is still a bit of stretching. It's not painful stretching, but I'm just conscious of the scar stretching. So in some exercises, like in, you know, you do triceps over your head and what have you, I'm kind of being a bit more conservative and doing weights that are kind of using everything else, but aren't using arms at full extension. I'm still being very cautious. Maybe overly so, but I love this chest, so I'm not going to risk it until it doesn't feel like it's pulling at all. I've also started back at cardio. Now, I'd started back at cardio at 8 weeks, and that was fine, absolutely fine. But I've had a lot of issues. I think, you know, if you've watched my other videos, I've done my back in, and I've had like some awful virusy thing going between my ears, my throat and my chest, which has been awful. the back's a long-standing injury I had ages ago, and every now and again I get a bit of sciatica, and it hit really hard, and I had to go and get some osteopathy for it. It could actually be a complication of top surgery in that, you know, I was very still, I was holding myself very strangely. So it's something to bear in mind. If you are someone that's got a previous back injury, it might be worth putting some measures in place to kind of try and look out for that, because I think that's probably what happened to me. It didn't manifest until I started to do cardio, and then it kind of came out. It's fine now, a few kind of sessions of osteopathy and some stretches at home, and it's fine. But yes, I think that undoubtedly holding myself differently didn't help that. And as for this kind of strange virus thing I've had going on, I've had the doctor looking at my ear thinking I've got glue ear, a perforated eardrum. They really didn't know. It went to my throat, it went back to my ear. And I wonder if that is a combination of being run down after top surgery as well. It's a massive strain on the body. I've been taking loads of extra supplements to try and help that, but, you know, it might be just one of those things. But so, no complications from top surgery in terms of my scars. My body's kind of gone a little bit, which is kind of understandable, really. So all in all, I don't want to go on too long. I just really want to flash and say I can't stay dressed. It's fabulous, and that now I'm back exercising, and it's just great, really. Everything's just coming back to normal. And one thing that I want to say is something that's happened in the last few weeks. I don't know if I can explain this. If you've had top surgery, you probably get it. But my chest suddenly over the last few weeks really feels like mine. It doesn't feel like I've got like a cut, scar or something. It's just chest. Do you know, it feels whole. It's quite bizarre. It's lovely. It's just like, yeah. But yes, I shall leave it there. Do you want one more flash before I go? Yeah, there you go. One last flash of the chest before I go. So, 5 months, 2 weeks and a couple of days post-op. That's that full extension. You can see how lovely and white they're going in places. It's patchy, but it's getting there. Chest hair is coming in. Come on, chest hair. So yes, at the bottom I will remind you what it is I'm using to massage with, and I'll put some links. Cool. Stop flashing soon. Put it away. Thanks for watching, guys. Any questions, please drop me a message. Take care of yourselves. Bye-bye.